Welcome to Tramlines, a podcast from Agrii. I'm your host, Tony Smith, putting your questions to the experts. Today we discuss the Agri Wellbeing Alliance, launched at LAMMA in January, which aims to improve mental health and well-being in agriculture. A recent study led by Professor David Rose at Harper Adams University, carried out for this newly formed alliance, highlighted the crucial need to broaden the safety net of support for the farming community, including help for those who become accidental counsellors. Today we are joined by Petra Martin from Agrii, Professor David Rose from Harper Adams University and Sam Downey from Mates in Mind. Good morning and welcome to Tramlines. So to start us off, maybe Petra, I can ask you first. Well, what is the Agri Wellbeing Alliance?
Okay, so it is fundamentally a coalition which was initially pulled together by the Crown Estate with involvement with Mates in Mind, NAAC, so National Association of Agricultural Contractors, IOSH from the safety side, the FCN, and with other supporting bodies such as Yellow Wellies and commercial partners like Agrii. And the vision of the Alliance was to work towards a farming industry where mental health and well-being can be prioritised, better supported, and most importantly, openly discussed. And the Alliance felt that it was really important to have the backing of research. You mentioned research in your intro, so that anything that the Alliance focused on was going to be evidence-based and trying to find initiatives that really work. So that we can make sure that the focus and direction is right, is going to be effective.
And David, I'm really interested, as I'm sure listeners are, to the research that you've carried out. And can you share a little bit about why is it so important to understand what is going on in our industry from an academic perspective?
Yeah, so I think why the research and the Alliance is important overall first is a good place to start. So we know that there are some people in farming who are suffering from very poor levels of mental health. And I think what is valuable about this research is it's looking at the role that can be played in supporting farmer mental health by those people who are interacting with farmers on a regular basis. The research also shows that even though farmers need support with mental and also physical healthcare, they can struggle to access that support. And that might be because in rural areas, there's poor availability of GP or mental health care appointments. It might be that farmers find it difficult to find the time to access appointments or very poor public transport, etc. It might be because there is some stigma associated with seeking help for both physical and mental health care, with a sort of stoic attitude in the industry. So we know that farmers can not always proactively seek support for their mental health care when we need it. But we know also that there are individuals, agronomists, contractors, land agents, health and safety consultants, veterinarians, who regularly interact with farmers. They go down the farm track, they might see them in an auction mart, at an agricultural show, and often build very trusting relationships with farmers, and therefore could be part of spotting signs of distress and signposting farmers towards support. So this research really was one of the first comprehensive bits of research to really look at how these individuals who regularly interact with farmers support farmers with worries, the effect it has on both the farmer but also the supporter, and to really try and learn lessons for how training those advisors with better mental health literacy, what effect that might have, so we can learn lessons about how to support the supporters but also support the farmers better.
And Sam, if I can come to you, I know that your organisation, Mates in Mind, are very much an active part of this alliance. What would you add to what David has just shared there from that research?
Well, I think what's important is the point that Petra made at the beginning, which is that we wanted to make sure that any interventions that we put in place were effective. And what we know is that whilst often interventions have been well-intentioned for mental health, actually it doesn't necessarily create the change that we're looking for. So we were really keen this time to bring our learning from other higher risk sectors, to bring it into farming and agriculture, and then to have researchers working alongside us as we delivered training programs to those accidental counsellors to find out how effective that was, and then to improve as we went along. And I think that's an unusual approach, and really important that that's the approach we're taking, because that will help us build trust when we are, of course, trying to get people to have conversations about things that they might be uncomfortable discussing. What we know is that at the core really is that people are usually feeling isolated, alone. Even if they have people around them, they don't feel like they can share their worries and concerns, that they often find they're overwhelming, and that perhaps they don't notice themselves becoming overwhelmed because they aren't used to noticing their thoughts, their feelings and their behaviour, and doing something about it, getting help. So it's really about bringing that understanding and then thinking, well, how do we make change at that level for those people that are struggling?
And Petra, coming to you, if you like, on behalf of Agrii, where you have a lot of people going down the farm drive, whether they're processing farm-safe seed or giving great advice. But what David was talking about there was, yes, thinking about the farmer, but also talking about that accidental counsellor, the person that is the support network that is there. So for you, what did this research really highlight?
Excuse me. So we were involved in the research. So in terms of the respondents asked to feed into that research, we asked our agronomists to help with that. So a lot of the input to the research that Dave has recently completed came from our agronomists and the agronomist community, as well as contractors and land agents. And I think for Agrii, it's obviously our customers are exceptionally important to us, and they're going currently through an exceptionally hard time. So, you know, it comes back around to what can we do? What can we do to support the customer? What can we do to support our advisors, or our agronomists and sales advisors that are going down the farm track? Because we talked about relationships earlier, and having an extraordinarily complex relationship that you get between a farmer and an advisory role. The isolation that Sam talked about means that sometimes that farmer's only talking to that person who's knocking on their door. So enabling those people, and from an Agrii perspective, that's our agronomists mainly, to be able to recognise things, to be able to use the right language, to be able to signpost is critically important. So that's what really we wanted out of this from an Agrii perspective. We want to be able to support our customers more, and we want to be able to support our accidental counsellors, not to become counsellors, but to be confident in that role and not to take it all home with them, or to have their own outlet.
And yet it's such a vital role, isn't it, that we all find ourselves in at times. David, what else did your research flag up and show about our accidental counsellors?
So we know that these individuals who take on these farmer worries, that affects those individuals. Many of them said, nearly all of them said, that the worries that the farmers had shared with them stayed with them at least some of the time. They took those worries home and it affected them. Some spoke about they were lying awake at night thinking about a traumatic conversation that they had had and not quite knowing what to do. And one of the key lessons is for those individuals, like agronomists and contractors and others, who are thrust into these accidental counselling positions, that they need their own support networks. So if you were a clinical psychologist, you would be expected in the industry that you're in to have those support networks to help you cope. But accidental counsellors may not have that. So it was a clear message that, yes, training could better help them have those conversations. So one-off training exercises, better embedding training into the qualifications that these people do before they qualify, but also that there has to be some aftercare afterwards. And that might come from the organisation that employs them, providing that, or using an external provider to provide that. For those who are self-employed, it might be thinking about support that associations or others can give to them. But it really is trying to make sure that you think of the secondary trauma that is faced by these individuals and how to better support them, and perhaps also to set some very clear guidelines and boundaries about what these people should do, that we're not expecting them to be counsellors. We're not expecting them to perform a role that is outside of their competence, and to make that very clear so they don't feel like perhaps they're being expected to do something for which they're not trained. It's really just helping them to prepare for the fact that they're likely to encounter those stressful situations and how they can handle that better and signpost accordingly so they can be part of the safety net, but not necessarily, of course, the only part of that safety net.
To find out more about the Agri Wellbeing Alliance, visit agrii.co.uk/news and media/news/Agri Wellbeing Alliance. And reading David's research, which is fascinating to read, from your point of view, Sam, do you think people wish to take on this role of being the accidental counsellor?
David said, it's important to emphasise that these relationships are there, happening daily, and have been for a long time. The relationships in the room when we were working with the land agents particularly had been going on for years, decades in some cases. So these relationships were very established and they were valued by both parties within them, the farmer, the family, the land agent, and the agronomist that we also had in the room. So I think what we were trying to do was to really say, we know the relationship is happening, we know these conversations are happening. In many cases, there was a want to be better equipped to be able to have the conversation, to understand what was going on within it, and to be able to signpost to support, so to feel more confident in having that conversation that they knew they were going to have anyway.
And Petra, how will the Agri Wellbeing Alliance help farmers and those who are talking to farmers?
Ultimately, what the Alliance is trying to achieve is collaboration. And the more parties you can get involved in this, the better opportunities there is for people to get the support that they need, regardless of whether they're farmer or somebody going down the farm track. And I think that's the focus of the Alliance, is that, you know, how can we celebrate what's already there? Because there's an awful lot of bodies, charities doing some fantastic work. There's a network there. It's available, it's used, but it could be doing so much more. There's support networks, there's charities available for the people who need to reach out and get that individual support, but perhaps they don't know how to, or they don't know who to go to. And that, I think, is one of the main aims of the Alliance, is just to clear those muddy waters a little bit, and really focus on availability, accessibility, and I think that's where the Alliance can make a real difference.
And Petra and Sam, you've both talked about some of the amazing work that goes on in our farming community. David, in your research, were there examples of that?
Well, we can quite clearly see that from some of the stories that are shared by those individuals who support farmers that we spoke to. So they clearly paint a picture of stressful situations that they've encountered and what they did that they felt that helped farmers. So many of these individuals just said they offered time to listen, and that was very valuable. Others painted a picture of them going above and beyond to help that farmer, to help with tasks, to make sure they checked up on them afterwards. What we don't have yet from the research is the farmer's perspective, of course, but very clearly you can see just how far many of these individuals do go beyond the scope of their visit and beyond their professional time to personally support farmers. The value of this alliance is to equip these individuals to look after themselves when performing these roles, and to equip them to have better conversations, or in some cases to choose not to have the conversations and signpost to others, because that's also important. We should remember that not all of these individuals who go out to farm are solely there to represent the interests of the farmer. And in some cases, therefore, these individuals might go to the farm and be seen as the source of the stress. They might say that you're behind with rent, or there is something wrong in terms of adherence to assurance, or etc. And that can put the individual in a very difficult position, because they're thinking, well, I'm being asked on one hand to look out for the mental health of farmers, but on the other hand, I'm the sort of messenger of stress. And therefore, also, this alliance can help those individuals, I think, with setting those boundaries, particularly if supported by those companies who employ them, to say, this isn't my area, but I know who else can provide that support and where those resources are that I can signpost towards, so I don't have to navigate this very difficult position.
Petra, what are the next steps for this new Agri Alliance?
Okay, so ultimately, we said at the beginning, the alliance is still in its infancy. We're still growing what it's going to look like, how it's going to support, and how it's going to make that change for the better, as you say. So one of the things we're doing at the moment is building a website. So what we want out of the website is to make access to some of these resources and the signposting a lot easier. So many charities and bodies out there doing all this work, but sometimes it's difficult to know which is the right one to find to reach out for you. And I think that's what we want to try and do from the website library, is to try and make it really clear. So if I want somebody local, how can I find them? I want somebody who's open at 2:00 in the morning. How do I find them? I want something specifically who will be able to give me advice from directly from a farming perspective. Who do I reach out to? And that's one of the fundamental sort of starting pieces we're looking at the moment. And then obviously linking on to what Sam was talking about in terms of what else can we do in that training area to support both farmers and the people who are visiting them.
And Sam, what would you like to see change in our industry over the next, say, 2 years? What would be the win?
We would like to see a sector that prioritises mental health and well-being of everyone in it from the beginning. And I think that has to be led at all levels. And I think the work of the Alliance means that we are working with organisations that are committed to making that change and leading it. That's what we're looking for. We have big ambitions in the Alliance, and we believe that we can achieve them by bringing organisations together. And as Petra said, there's so much good work already happening. Part of what we want to do is just start signposting to what's there.
And David, you started the podcast very much talking about the research that you had undertaken. What would you like us to think about as we switch off this podcast and go about our day's work?
So I still hear phrases like, you're not a real farmer if you take a holiday and take time away from the farm, or you don't really need to see a doctor about this because it's not that bad. Sort of almost that sense of stoicism and that normalization of not feeling well. I would really like the Alliance and all the fantastic people who are working in this area to shift the dial on that and to challenge whenever we hear someone say that, think, well, are you sure that's a good thing for your well-being? Is that a good message to put out to others, including those who want to join the industry? And can we see really reaching out for support with mental health and having conversations around mental health as a strength and not a weakness?
Thank you, David, Sam and Petra, for sharing the research and aims of the new Agri Wellbeing Alliance. Why not listen to other recent episodes here on Tramlines? Strategies for resilient farming and building crop resilience. If you have any questions for our experts that you'd like answered, email them in to info@agrii.co.uk. That's it for this podcast, but do tune in again as we meet the experts throughout the season, exploring the many immediate and longer term questions for growers and farmers in the UK. See you next time.